This is kind of just an overview of the webinar series that we have. So we are obviously in the second session there on collecting quality data. But if you haven't already, the first session that is recorded, you can go back and review that recording. That really kind of dives into understanding kind of the purpose of screeners, how we use them, why we use them, and kind of the mindsets that we have to have for using screeners. So kind of sets up the background on screening, what it is and what it isn't. Today, we're going to talk about collecting data. How do we do that? So a lot of logistics, right? So what are the things that we need to think about to make sure that we're collecting data with fidelity that's going to be meaningful and impactful for our students? And then the last session next month, we'll dive into more depth on how do we use data, which is where we all want to get to, right? We want to collect data for the purpose of changing instructional outcomes for our students. And so we'll talk about a couple different uses for using screening data. We'll talk about how you use it to evaluate tier one practices, but we'll also talk about how we use it to identify students who will need some additional intervention, be it tier two or tier three intervention. So we'll dive into use of intervention a little bit more in the next session. All right. But today we're really focusing on logistics. So what are some things that we want to think about to make sure that we do get those high quality data sources or data, data points that will make sure that we can change instruction for our students. All right. So what to expect today? I started a lot of presentations like this, so just something to kind of think of. So expect some information that will be new. Hopefully will be new. Obviously, the reason that you all came today is that you want to learn something. And so I'm going to share some information that will be new to you. Hopefully you'll learn some things you can take back to your school, but also recognize that you're hopefully going to hear some information that will be review. And so especially if you've already been collecting screening data, be it the RDRS or just literacy screening data in general, some of what I talk about should be review. And so that's a good thing. We want to be affirmed in the practices that we're currently implementing, the things that we're doing. So if you hear something, you're like, yes, we already do that. Like, pat yourself on the back, like celebrate that you've already got a lot of great things going on. And then be prepared for some information that may challenge you, right? I may say something in a different way that maybe you hadn't thought about it that way. I may say something that you maybe kind of disagree with a little bit. And so one thing I've learned in doing this work in a lot of different districts is that it doesn't have to look one way. There are some non-negotiables, some things that we have to have, but there's a lot of different ways that we can implement a lot of these things. And so just because you hear something that maybe you don't do it that way, it may work for someone else, and it may be something still we want to hang on to, but it may not be something that fits your context. So be okay with that, and just again, try and take away things that are going to be impactful for you at your setting and your site. All right. So I want to start by talking about this idea of database individualization, because at the National Center on Intensive Intervention, this is really our kind of framework, our guiding star of how we support our students. And so database individualization, above all, is a process. It is not a one-time fix. It is not a program. It is not something that looks exactly the same everywhere, but rather it's a process for how we want to individualize and intensify intervention supports for students that have the most significant needs. Again, that includes kids with significant academic needs, as well as significant behavioral and social and emotional challenges. And the process really looks at evidence-based interventions, assessments, how we use those to drive interventions, and strategies that we can use to adapt and improve the interventions that we're providing. And so the research based on database individualization and all its components go back decades, as early as the 1970s, 1960s, even, with some of the early work around curriculum-based measures and effective instructional practices. All right. And so the process is really 5 steps that we talk about, and we'll go through these kind of quickly. But the first step in DBI is that for our students that need additional supports, we want to provide a validated intervention program. And so that's some evidence-based program that has some research behind it, that when we deliver it with fidelity, it has a high likelihood of working and supporting students in making important growth. And so not to say one intervention is not going to work for every student, but if we implement and start with at least evidence-based practices that are matched to a student's need, we have a high chance that that's probably going to work for most students that receive that intervention. And so, for some students, that intervention will not work. And so for all of our students receiving intervention, the way we determine is it working or is it not working is by collecting progress monitoring data. And so this is going to tell us on an ongoing basis, is our support effective and supporting students to make growth towards important, meaningful goals, or are we not having the impact that we would like to have? Are our supports not meeting the needs of these students? And so we collect progress monitoring data, and for some students, again, they'll be responsive to that intervention, and we're going to continue to implement that intervention for as long as they need it, and eventually, hopefully, fade that intervention. But for some students, they will not respond to the intervention. They will not make adequate progress towards the goal. And that will tell us that we need to move on to the next step, which is to collect some diagnostic data to develop a hypothesis around why do we think this intervention is not meeting their needs? Is it the instruction? Is it the curriculum? Is it the environmental supports? But something we are doing is not currently working. And so we need to ramp that up and provide some additional supports for a student and figure out how we're going to adapt that intervention to make it more matched to meet the needs of the student. And so we collect some diagnostic data to figure out, what we do next, and we adapt that intervention in some way. And so that could be we change the group size, maybe we change the program, maybe we add a behavior component, a motivational system, maybe we make the instruction more explicit, we give more student responses. Whatever it is, we adapt and change something to meet the needs of the student to make that intervention work more effectively. And after we make that adaptation, we continue to progress monitor. That's step 5. We just continue to measure, is that intervention better matched and better meeting the needs of the student, or do we need to make a change? And when we find if it's not making a change, we go back to that diagnostic data piece. We develop a new hypothesis. Okay, we thought it was this. We collected data. We made an informed guess based on data, but it didn't work. And so we don't throw our hands up and stop there, but we continue to problem solve and collect data until we figure out what is going to meet the needs of a student and how we can provide that effectively with the resources that we have. And so it's an ongoing process. Like the DBI process doesn't really end until a student no longer needs a validated intervention. The student is, reading at grade level without the need for interventions. The student is meeting behavioral expectations without the need for additional support. Whatever those grade level expectations are, the student doesn't need additional supports in order to meet them. So those are kind of the 5 steps of DBI. So today, what we're talking about in this whole series is this idea of screening. And so where does screening fit into this, you may be asking? And so screening is really the entrance point into this whole process. Screening is how we create a standardized way, a relatively objective, nothing is 100% objective, but a relatively objective way to identify who are those students that are going to need intensive intervention through this process. Who are the students that we know if we don't, ramp up instruction and provide something different, that they're not going to meet future reading benchmarks, they're not going to become proficient readers. And so screening is kind of the on-ramp to this whole process. And this is kind of a shift from maybe a more traditional educational system where the way to get interventions was really through this teacher referral process, through teachers being an incumbent upon teachers for them to either be frustrated enough, or maybe they don't have the skills, or maybe they're just really good advocates for their students and they have to actively refer a student for supports. And so we're trying to move away from that process because we know that process has historically been inefficient, but more importantly, maybe it's been inequitable. Right? Like some students are going to get referred more frequently. Some students are going to get referred less frequently. And much of the time, it has little to do with who actually needs support, but it's more who looks like they need support. And so if I have a teacher, maybe that is a new teacher, doesn't have a whole lot of skills, I may be, referring more students. Whereas if I feel like I can handle more difficulty, maybe I'm not referring my students. And so we want a more kind of consistent, standardized, objective way to do that. And so screening is the way that we identify students pretty early on, who are the kids that are on track to be proficient readers and who are the kids that need some additional support. And so, as we think about just that general purpose of screening, I use a lot of analogies when I present. So, if you've seen me present on screening before, I use the analogy oftentimes of like a doctor's visit when we think about like just assessment in general. And so, screening is like your once a year annual physical checkup that we all should get. We all don't always aren't always good about getting that, but we should. But when you go in, you get some pretty consistent measures, assessments taken, right? Like you get your temperature taken, you get your weights, you get your blood pressure taken, as you can see there. Sometimes they do some blood work, but those are all real quick, easy assessments to help determine is your health generally on track, or are you going to be in need of some additional like intervention and supports? And so the screening process is meant to be pretty brief and pretty quick to be able to do that. And so, similarly, reading screening is the same kind of type of assessment, is that we want to look at all kids with a relatively brief, easy assessment that we can give everyone so we can determine who are those students that are going to need some additional supports later on down the line so we can prevent significant future problems, right? Like the reason we get screened every year is we don't want our blood pressure to get so out of whack that we need open heart surgery. We want to know if I'm at risk for heart disease, if I'm at risk for high cholesterol, if I'm at risk for something else. Like I want to know about it pretty early on so I can prevent that from happening. I can take steps in my lifestyle and have medical intervention to make sure that that doesn't happen. And modern medicine is pretty good at that, right? Like there's a lot of things that we can detect pretty early and we can prevent. Same idea with screening for reading. We want to detect early who are the kids that may need some additional supports and provide those pretty early on. And so, one thing we want to think about, though, in the screening process, and this is a little bit counterintuitive, but I think it's important to recognize, is that the goal of the screening process is not for all your students to get a high score. The goal of the screening process is for all your students to get an accurate score. And so, the goal of instruction is for all your students to get a high score. When you teach, you want to teach in ways that really gets all your kids successful. But collecting screening data in general, I don't want to do anything in the screening process that is going to inflate scores so that all my kids look good. Um, Screening is not a high stakes assessment. It should not be used as a high stakes assessment. We have plenty of those in education, right? Like statewide testing. We have other things that we are evaluated on that go in the news. Like if your test scores aren't good, like you end up in the news sometimes. Um, we don't need screening to be that. Screening needs to be accurate. Screening is a very quick, low stakes assessment just to determine who's on track and who's off track. And so if we're inflating scores, if we're making all our students look great, we're actually doing them a disservice because we're preventing services from being provided to kids that actually need it. It's the same as if I go to the doctor and my blood pressure is high every year I go to the doctor and the doctor keeps telling me doing great, like everything looks wonderful. Like then I don't change my lifestyle. I can't like get the intervention early treatment to prevent later problems from happening. Because if you're inflating early screening scores, either purposely or unpurposely, at some point kids are going to start to really struggle with their reading. And we've lost all this time where we could do something upfront to prevent that from happening. And so the goal of screening is just to collect accurate data, be it high, be it low, it doesn't matter. I just want to know where kids are at so I can really be informed in my next steps. Now, again, instruction, your goal every day as a teacher is for your kids to get high screening scores. But when you're actually collecting that data, I just want to know accurately where are kids at. All right. So when we think about screening steps and we think about like, what are we really trying to accomplish here? Just moving this around real quick. Um, you've all selected a screener, right? Like you've got the RDRS, there's 4 options, they're all good options. You select a screener from one of those options. And where we want to go is we want to select our screener and we want to use an evidence-based screening tool. And again, all the things that you have to choose from, they all meet these criteria, right? Like these are all evidence-based reading screeners that you can use. So again, think about the medical screening, like it's a temperature check, it's a blood pressure check, it's listening to your heart. But these reading screeners are going to meet these criteria, right? They're brief, they're quick, they take minutes to administer, not hours. They're consistent over time, so they're going to give you a consistent measurement, a reliable measurement over time. Um, they're going to have strong correlations between the test scores that kids get on these screeners and future reading outcomes. So kids who do well on reading screeners are typically on track for future reading proficiency. They accurately predict, so they've got cut scores that pretty accurately predict who's on track and who's not on track. And typically, not always, but typically you want your screener to be administered more than one time a year. So fall, winter, spring, because you want to be able to track that progress over the course of the year, right? And so you select your screening, you've all done this piece, and where we all want to be then is we want to move to this piece where let's use the screening data, right? Because screening in and of itself doesn't change outcomes. It's what we do with the data that changes outcomes. So we want to move to this spot. But we have to recognize that there is a step in between this first bubble and this last bubble, is that we have to collect the data. And sometimes we overlook this collection piece, or we rush through it, or we try to get it done as quickly as possible so we can get on to using the data. And that can be dangerous. And so we want to spend some time, we're going to spend some time talking about it today, but we want to spend some time thinking about how do we make sure that we're collecting really good, accurate screening data. And in general, when I think about this kind of concept, I think of this idea called the planning fallacy. And so maybe you've heard of this before, maybe you haven't, but I'm sure you've all experienced this in your life. And it's this basically, essentially, it's this idea like everything, most things that you want to do in life, they take longer than you think they're going to take. For whatever reason, we vastly underestimate the amount of time it takes to do things. So I have little kids. I have a 3-year-old and a 7-year-old. So I vastly underestimate everything because it takes a ton of time. But even as adults, right? Like when I'm not with my kids, I think something's going to take 15 minutes. It takes 30. That's just human nature. It's one of our cognitive like biases that we have. So you think about like implicit biases, like hindsight bias, like all of these like flaws in our thinking. This is one of them. We just tend to underestimate the amount of time and effort it's going to take to do things. Even if we've experienced it before, we think it's going to go better this time. It typically doesn't, right? And so what I'm trying to say is like we're going to talk about today, like what are the things that we want to be intentional about when we plan for screening so we don't fall in this planning fallacy that we're going to be like, oh, I just gotta like, we've got our screener, I'll just give it to the teachers, they'll give it and we'll be good. Like, no, there's things that we need to think about. There's logistics that we need to follow in order to make sure that we get really good quality data. All right. So some of you may have already started to administer your RDRS screener. You may have done that in the fall. Some of you may be waiting until the winter to start doing that. But I want you to I'm going to put up 4 pictures here, and I want you to put in the chat a 1, 2, 3, or 4, which one best describes your current situation for RDRS. And so the first two are going to be for those of you that have completed your first screening. Which one is you? If you've completed your first screening, if you did it in the fall, are you number 1, went really well, killed it, like we feel great about it? Or are you a number 2? We did it, could have gone better. Like, maybe it wasn't perfect, maybe it was not great at all, but like either way, like maybe it could have gone better. So if you've completed it, are you a 1 or a 2? If you haven't completed it yet, where are you at? Are you number 3, where you're like, we're ready? We got everything, we got our technology, we got our probes ready, you feeling pretty good, or just like we are dreading this, like number 4, like we are not ready yet, we just do not feel like we're ready to collect this data. So in the chat there, just put how you feel it, 1, 2, 3, or 4. All right, so we got a 2, we got a 4. Where else is everyone at? Maybe in between 1. They're 4. Yeah, so not feeling ready. Yeah, so for those of you that are not feeling ready yet, or maybe could have gone better, you're in the right place. We're going to talk about, some things that you want to kind of think about and consider as you kind of move forward with collecting your data. So if you have collected your data, there's a few of you that have a question for you here. So if you screen using the RDRS, or maybe it's another literacy screener, if you've done other literacy screening in the past, in the chat here, or have done this in the past. So in the chat, I just want you to add in what's one success. So you've collected screening data. What's one thing that you are proud of, or one thing that went well in collecting either the RDRS or other literacy screening data in the past? I'll give you a second there to add that to the chat. All right, so able to have timely conversations regarding individual students and next steps. Yep, great. That's great to be able to collect that data and use that pretty quickly. Refining the process so the screener is universally administered. Yeah, monitoring completion follow-up. Yeah, ease of administration. Yeah. Yeah, and that's like a lot of these screeners are designed to be fairly easy to administer. You don't need a whole lot of complex training. You do need training to be able to administer these. They're designed to be that way because they're supposed to be quick and easy. All right. So, and some of you kind of put this in the chat already, but what's one challenge? Like one roadblock you had, or just question you had, or something that maybe didn't go as well as you would have liked for your screening. Give you a chance to put that in the chat too. Yeah, not fully prepared for accommodations. Finding time to train the staff. Yeah, so there's consistency. Absolutely. Yeah, it always looks, and if you've watched like screening videos of people like giving the screener or whatnot, or reading about it, it always looks so simple and straightforward. But once you actually sit down with actual kids and start to give that, then it gets complex and it gets a little messy. So yeah, so successes, challenges, I think that's going to be the norm. Like you're always going to have successes and challenges with administering these assessments, but hopefully over time the successes outweigh the challenges. All right. Yeah, teachers vary on how they administer it. Yeah, yeah, absolutely. All right, so we're going to talk about then some things to consider as you implement screening that can help improve the quality of your data collection and the quality of your data. And so I want to talk about these categories of things. And so there's some things that you want to consider before you even start screening your kids to set you up for success. But then also a category of things that you want to do either during screening to make sure it goes well, or after screening to make sure that your data is high quality. And so I'm going to talk about each of these things in a little bit more depth. But before, some things that we want to make sure that we're attending to are determine who's actually going to give the test. So we'll talk about some different options for how you can approach that. How are you going to train whoever you decide to give the assessment? Consider testing logistics. So planning, again, think about that planning fallacy. It's not just enough to give your trainers like the probes or the technology and say, go forth and give this. Like we want to consider how we're collecting that data to make it go well. And then how we prepare our students and families for the screening. Like just even our messaging of how we message that to families and students can have a pretty big impact on the data that we collect. All right. And during and after, the things that we're going to talk about is how do you manage that testing environment? How do you make sure that kids are giving their best effort and getting a good, accurate bead on where kids are at? We're going to talk about fidelity checks. How do you make sure that we're collecting accurate data? how you make sure that we're scoring it accurately and entering the data accurately. I know some of the systems will enter it for you as you score it. It'll go automatically into your database. Some of them you're going to have to collect it and manually enter it. So we're going to talk about things to consider there. And then I'm going to talk about last this idea of risk verification procedures. So this idea, we're collecting our screening data. What are some ways that we can make sure that our screening data is accurate and telling us what we really need to know for our students? All right. So I'm going to start in this before section though. So the first thing I'm going to talk about is who's going to administer your screener. And this is one of the first decisions that you should really kind of think about. And there's typically, I find, two different ways that schools approach this. And this isn't a like one is better than the other, do this, not that. It's that these are both really good viable options, but depending on which one you do, there's pros and cons and things that you're going to have to attend to and really think about. And so those two kind of ways I see it done work well are either you're going to have a school-wide assessment team, so you're going to have a core group of people to assess all of your kids at the school, or you could have teachers assess their own students. And so I want to talk about pros and cons for each of these. And so the first one is the school-wide assessment team. And so this is where you get, however many people, you determine what capacity you have to pull people to do this work. But it can be comprised of a wide range of people, right? You could have interventionists, you could have specialists, maybe your school psychologist is on this team. I've seen administrators be a part of this team, instructional assistants, whoever. But you pull a bunch of people that are going to be your school-wide assessment team. They're going to collect that data. And so pros and cons to doing it that way. And so the pros, the first one and foremost is that the less people you have assessing, um, the higher likelihood that you're going to have consistent administration. So fidelity of data. So for example, if I train 5 to 10 people to do this and collect data across my school, I can really tightly control that training and tightly control to make sure that all of them are giving it in a very consistent way from class to class, from benchmark period to benchmark. And it allows me to focus my training on fewer people to have much more tighter administration. That's one pro. Second pro is efficiency. So this can get completed relatively quickly, as short as a day, depending on how many kids you have and how many testers you have. And so the idea, you could do it a few different ways. You could have a centralized location like the gym or something where teachers send their class down. You can get through a class pretty quickly depending on how many assessors you have, and then the kids go right back to class. So you can rotate it that way. Or I've seen also like that testing team moves from classroom to classroom, descends on a classroom, and within 15 20 minutes they've assessed all the kids in the classroom. Again, depending on how many people you have on this team, it may take a little bit longer, but in general it can be a pretty efficient process. You can get it done pretty quickly. The last pro is that you're going to lose less instructional time typically, because you don't have teachers doing this with their own students. They're not going to have to lose instructional time and stop teaching while they assess all their kids. And so that can also be a pro. And so some pros to the school-wide assessment team model, but there's also cons to this. Is that one is that it requires coordination and scheduling, right? You have to have someone in charge of this. You have to have someone secure a location, take care of materials. You may need someone to, if you're pulling like interventionists or instructional assistants, you may need someone to supervise kids while they're not doing their duties. You may need to, you may lose intervention time if that's happening. But you have to coordinate and schedule, how that team moves or collects data. Another con is that potentially there can be less ownership from teachers. If teachers aren't collecting the data themselves, sometimes they feel less invested in the process. And sometimes you probably experienced this where a teacher sees their student's data that's been collected by another tester and says, well, my student can do better than that. Like that's not an accurate representation of what my student can do. And so if they're not testing their own students, sometimes there's a little bit less teacher ownership of that actual assessment data. And then the last one is less familiarity with the students. So if you've got like people rotating from classroom to classroom, maybe I'm an interventionist who hasn't worked with a lot of these students. They don't know me. I may have to spend some more time building rapport. They may not be giving their best effort. They may, some kids are intimidated by people they don't know, and so you may not get a pretty accurate judgment of who they are if students aren't trying their best for someone other than their teacher. So another kind of thing to think about. Um, Going along with that second point too, potentially as teacher ownership, the other kind of piece to that is um, it's important for teachers to hear their kids read. And sometimes we get caught up in the score of what kids get on these screeners, and we get less concerned with how a student got that score. But while the score is important, sometimes it's more important how the student got that score. Like what type of errors did they make? Were they fast? Were they slow? Where did they slow down? When they made an error, what did they do? Did they self-correct? Like some of those things don't get picked up in a final score. And sometimes it's good to hear teachers to hear their own students reading. And so that can be a con. These cons aren't like, I'm not saying like don't do school-wide assessment team. Like, again, I've seen both ways collect really awesome high quality data, just things to consider as you figure out like which one you prefer. So those are pros and cons of school-wide assessment team. The other model there is if teachers are just collecting data with their own students. So this is just where like you've got 25 students in your class. You need to get these assessments, these screeners done with your students on your own time. And so pros to this one. One is that there's familiarity, obviously, with the students. So students may try harder, they may work harder, they may feel more comfortable with their teacher. So you're going to get maybe a more accurate score there. You're going to have more teacher buy-in. Teachers are going to get to hear their kids read. They're going to see what those assessments look like and be an integral part of the process. And then teachers do have a better understanding of that score, right? They can understand like, oh, well, they made these types of errors. Like diagnostically, there's a lot to be gained from listening to a student read and hearing, where they're strong and where they're not. So there is benefit in having teachers hear their own students read and collect that data. And so those are pretty big pros for teachers doing it with their own students. But again, there's also cons to think about. So the first is that fidelity can be a challenge and can be variable. And so think about if I have to train and have 5 to 10, you know, testers give that assessment, I can get that fidelity a little bit tighter because I don't have as many people doing it. But if I've got like 10 to 20 teachers doing it with their own kids, then it gets to be a little bit more of a challenge in making sure everyone's on the same page and having consistency in how teachers are administering it. So something that we want to think about. Also, lots of instructional time. So as teachers are testing their own kids, they're obviously not teaching. And so, when we're pulling teachers away from their instructional roles, sometimes, we lose a significant amount of instructional time to do that. Um, and then also just the increased burden on teachers. So it's another like thing that teachers have to worry about, right? They have to get trained, they have to manage materials and resources, they have to make sure to get the data collected, entered, all those things. Like it's just another thing for teachers to kind of worry about. And so all of these things are pros and cons. As I talk through like the rest of things to consider, like there's nothing on here that I would say like can't be overcome. There's nothing on here that should prevent you from saying we're going to do it this way or that way. But you got to look at your own resources, your own capacity, to make sure that you are collecting data in the best way for you to get high quality data that you can use to impact students. So again, not a better or worse, one is better than the other, but you want to make sure that you're considering which is going to work better for you. All right. So, real quick, then, in the chat, as we kind of think about these two, um, just kind of put in the chat which option have you used, will you use, and then maybe one consideration that resonated for you. Maybe it's one of the pros that you found, like, yes, this was great that we did it this way. We really appreciated it. Or maybe it's a con that we did it this way and we had a really hard time with this, or we're really concerned about how we prevent this. So, which option will you use or did you use? And then one consideration that resonated for you. So I'll give you a second to put that in the chat here. All right. So still considering leaning towards assessment team, lessens the burden on teachers. Yeah, concerned that teachers make an assumption based upon results. We'll see lots of referrals to special ed. Yeah, yeah, that's a concern. And we'll talk about just like obviously like messaging is going to be important about how we talk about screening data. Um, but yeah, assessment team can be an effective way to lessen that burden on teachers. Kelly, thinking about teachers assessing their own students for better understanding of scores, more buy-in. Yes, absolutely. Jennifer, done it both ways. Think the buy-in from teachers and understanding the scores is important. Yes, I agree. Yeah, and I mean, I'm in the camp like I would love for teachers to do their own students. Like I said, one is not better than the others. Best case scenario, teachers are doing it with their own students, and we can make sure that we've got consistent administration. We're not putting too much on teachers. All those things. Like the cons are pretty significant sometimes with teachers doing it with their own kids, but if you can mitigate those, there is significant value in having teachers hear their own students read. So if you could do it that way, it's nice. But again, things to think about. Not to say school-wide assessment team is a bad way to do it. I've also been part of many teams that have collected that way and gotten really high quality data. So something to just think about as you think about who's going to do it. Right. So first thing we talked about is who's going to do it. Next thing is whoever you're deciding to do it, you got to provide training and support. Like teachers, assessment team, you have to train the people administering it. So things to think about. So first is consider both initial training and ongoing training. So for example, like we, get an assessment, we train our folks on it, but making sure like, are we providing refresher trainings? Like it's nice to be able to do that before each screening session. So we train everyone in the fall, we administer it right before winter. Like we're going to go through a training again, not a full training, but just reminding people, here's the measures, here's the rules, here's the resources, all those things. So it's fresh in their mind because if you're only doing this 3 times a year, it's hard to like, you're going to forget a lot of things from the last time you did it. So you want to make sure that you're refreshing people on an ongoing basis. And it doesn't have to be like, there's different ways to do it, right? Like there's in-person options. You can do virtual trainings, synchronous. You can create asynchronous like videos for refresher trainings, just like 5 to 10 minute videos of reminding people how to administer the assessment and whatnot. So do what works for your site with the resources and time that you have. Um, with that training, it's always helpful to provide practice to actually administer the training, administer the screener as you're training. There's nothing worse than like you learn all about this screener and then you go sit down and do it with actual students and it feels different, right? And so as much as possible, at least practice it with adults if you can. If you can practice it with kids, have real kids to practice it with, that's also helpful. I remember like when I was in graduate school, like we would pull like whichever one of my colleagues had like kids, we would pull their kids and give them some reinforcers to do it. But we would practice the screening assessment with them because it's just good to get that practice with actual kids. So as much as possible, practice ahead of time. Use observations and fidelity checks, which we'll talk a little bit more to determine what's going well, what's not going well. Like if I'm observing and I'm finding teachers are having a real problem managing the materials or scoring in the correct way, that tells me I need to train better on this thing next time. And then it's really important to communicate the purpose of screening with all of your staff, especially those delivering it, and really emphasize the importance of standardized administration. All these assessments are designed to be delivered in a standardized way because we know a score is reliable and valid if it's delivered in a standardized way. If I deviate from that, in ways that are not like allowable accommodations. Many of these assessments will give you allowable accommodations, meaning you can do it in this way or that way and still have a valid score. But if I deviate in ways that are not allowable, then the score, I can't interpret it. If I give a kid a little bit extra help or I give him a little extra time, that score is not a valid score. And so we want to make sure that our staff understands that again, that the purpose of screening is not a high score, it's an accurate score. Because many of us have been guilty of this. I know I have been guilty of this, so I will fully admit it. Like I've been giving screening assessments to my students, and like they're right at that benchmark. I know come a minute, and I know if I just give them a couple extra seconds, they're going to hit that benchmark. So I'll just give them a couple extra seconds. And then they hit the benchmark, we celebrate, great. But I've done that kid a disservice. Like again, I elevated that score where it's not an accurate score. And so I've prevented them from being identified in need of additional support. And so we want to make sure people understand the importance of doing this in a standardized way. And then, regardless of who's training, who's delivering these assessments, you should have some sort of training for all of your staff to understand what the data is and what it isn't. So, thinking about if you're using a school-wide assessment team and you're not training your teachers on the assessment because they're not giving it, you need to provide some level of training so they understand what that score means, because you want them to communicate it with parents. You want them to communicate to the student. So they also need to have some level of training about what that screening is. So don't just provide training to just the people administering it, provide some level of broader training, just understanding what it is to all of your staff. So we provide training and support. Also consider logistics, some things that get overlooked. So again, remember the planning fallacy. This is going to take longer probably than you think it's going to take. And so you want to ensure that you have sufficient materials and or technology available. If you're giving it on iPads, make sure you have enough iPads. Make sure you have more than enough iPads in case some of the iPads don't work, because some of the iPads will probably not work. So make sure you have enough of whatever it is. If you're giving it paper and pencil probes, make sure you have extra copies of it. You want to make sure that you don't have to, adapt in the middle of the testing. Also build a testing schedule with a finite window and ensure everyone knows what their role and job is within that window. And so there's a couple ways to think about that. One is that screening, for you to compare all students against the standard, they all need to be assessed within relatively the same amount of time, meaning time on your calendar. And so this is why it's nice to have a school-wide assessment team, because every kid will get screened maybe in these couple of days, and you can compare all of that data. But if we've got teachers screening their own kids and we say, all right, you've got this month or 6 weeks, get your kids tested within this 6 week window. Some teachers are going to test them right away. Some teachers are going to test them at the end of that 6 week window. What you've done now is these kids that took it at the beginning now have 6 weeks less of instruction than the kids at the end of the window got. And so you can't compare those scores because they all haven't had the same opportunity. And so we want to make sure like all kids should be tested within generally a week or two. That's ideal. Now, many of the test publishers have recommendations for what that window should be, and absolutely follow that. But in general, test kids as close together as possible. And then consider the amount of testing time per student. Like they'll tell you this takes 5 to 8 minutes for each kid to test. Plan on 8, right? Like don't plan on like, all right, I'm going to do every kid in 5. We're going to be good. Because I'll tell you, you're going to run out of time because every kid's going to take a little bit longer. You're going to have to get them in. You're going to have to get them out. The idea is not to like ship kids in and out as fast as possible. You're going to say hello. You're going to like, interact with the student. So just plan for more time than what you're going to need. And then plan for makeup testing, right? You're going to have kids that don't show up that day. You're going to have kids that, for whatever reason, maybe they just couldn't pay attention that day. I've had testing environments where like our school-wide assessment team is testing and the fire alarm goes off right in the middle. Like you can't just like save that test or that score. Like you're just going to have to do a different one. Like have a plan for how you're going to make up testing, be it a different day, different location, whatever it is. All right. So those are logistics. And then make sure you're preparing your students and families for like what it's going to be like. So how do you communicate what screening is? Again, communicating, it's not a high stakes assessment. We're just trying to hear these kids read in the best way possible and show their best selves in terms of their literacy skills. And so we want to make sure kids come to school prepared and clearly understand what's going to happen and how it's going to happen. So making sure kids have a good breakfast, a good night's sleep, understand that they're just going to be like reading some passages or saying some words. You want to be very clear about what this is so everyone can ensure that kids are going to give their best effort. And so how can families reinforce that message that you provide to their students while they're at home. So you want to make sure that you're communicating that clearly ahead of time to students and families. All right. So those are all the kind of before testing things, right? We talked about who's going to test. We talked about making sure that we're providing training and support to those testers. We talked about just some of the logistics during testing and then how we prepare students and families for that testing. So I want to shift gears now and talk a little bit about what are some of the things that we want to make sure we're doing during and after the testing to make sure we've got accurate data, right? And so it is. So the first one is we want to think about how we manage that testing environment. Um, so a few things to think about. Talked about this a little bit, but make sure you're building rapport with the student and encouraging their best effort. We don't want kids to come in, sit down with the tester and like jump right into it. I know we want to get kids in and out. We want to be efficient, but you also want to make sure that kid feels comfortable. They're ready to go. I'm not suggesting you have a 5-minute conversation with each kid that comes in, but like just welcoming them, ask them how their day is going, preparing them for whatever's going to happen, and then moving into it as necessary. But making sure that you're building that rapport with students is going to be important. As much as possible, minimize distractions. So think about where you're testing, what else is happening. If you have a quiet testing environment, make sure that happens. As much as possible, if you can minimize like the fire alarm going off, other big things, like do that. You want to make sure you've got kids can focus. Make sure you're adhering to standardized administration. So most of these things have standardized directions that you're going to read. And I've given like screening assessments hundreds, probably thousands of times. And I get it. Like, I don't want to read that script one more time. Like, it is monotonous, but it is important that you do that. Now, it's not to say you read it like a robot, right? Like, you want to give it some life, give it some pizzazz, like, make sure that you're interacting with the kid and, matching their energy. But it's important that we're giving each kid the same standardized administration so we can get an accurate, reliable, valid score. So that includes reading the student instructions in ways that they're meant to be read. Um, Only providing approved student assistance. So there's approved like ways, like if a student gets stuck, there's prompts that you can give. There's certain levels of help that you can provide, but those are generally approved by the tester. Again, because they've given these assessments, created these norms, created these benchmarks based on the test being given in a certain way. And as long as you give it in that same certain way, you get an accurate, reliable score. If I start giving kids help or giving them prompts that are not on the approved list, then I'm giving them a better chance at the score than someone else, and I can't really compare that score. Timing and scoring procedures, again, make sure you're accurately timing and scoring in ways that are approved, accurate scoring methods. And I know some of these measures, like many of them are individually administered, but some are group administered where all kids are going to sit on a computer and kind of go through this assessment. For those, make sure you've got close supervision of kids. Like this isn't like you put all kids at the computer and you go sit down at your desk and wait till you're done. Like you got to wander around. You got to make sure kids are actually trying. Because especially you get down to kindergarten, man, like those kids are just pressing buttons. Like some kids have never seen a computer like this. Like you got to make sure kids are providing their best effort if it's a group administered measure. So you really have to be intentional about that as you're managing that testing environment. All right. So we manage the testing environment. I also encourage you to think about fidelity checks, or quality control to make sure that we're getting accurate scores and people aren't drastically drifting away from accurate scoring procedures. And this is really easy to do. I've tested a lot, and sometimes like even because you only give them 3 times a year, I forget. It's like, oh, well, he made that, like he said it that way. Do I score it this way? Do I score it that way? It's really easy to just drift into what's comfortable and forget kind of some of the scoring rules. And so fidelity checks can help with that. So we recommend, like, if you can, brief observations or side-by-side scoring for about 5 to 10% of administration. So that's about 1 out of every 10 to 1 out of every 20 kids, if you can. Sit side by side with another adult giving that and just score it on your own and see like how close are the scores that you got and your co-tester got. They don't have to be exactly the same, but if they're like 1 or 2 points off, you're fine. But if like I'm getting this kid like segmented like 10 sounds and you got this kid segmented 30 sounds, like those are drastically different. Like something's off about how one of us is scoring that. So you want to make sure that you're, sitting down and just checking randomly. It doesn't have to be like any specific like, teacher or kid, but just like randomly sitting and maybe scoring that together. You can also provide a self-report checklist for staff. Many of the assessments have like fidelity checklists. You can give that to staff ahead of time just to know it's like, okay, like I read these directions, I scored in this way, this is how I time, this is how I use the materials. Like we're not trying to, it's not a gotcha with the testers. It's really like we need to do this in a standardized way so we can have accurate data. And again, like as much as possible before screening occurs, discuss the purpose of screening at staff meetings. Like again, we want to make sure they understand standardized administration is important. We need to give it in a standardized way. I'll reiterate this again. The purpose of screening is not for all your kids to get a high score. The purpose of screening is to get an accurate score. Yes, if I give the kid a little bit of extra help and do something that's not in standardized administration, sure, like they're going to get a higher score, but it's probably not going to be an accurate score. So just something to kind of think about there. All right, we've got a question here. Let me see if I can answer this. So when time allows, will you please clarify if district should use the same screener for students with the most significant cognitive disabilities? So students who take summative alternative assessments and students who are nonverbal. If accommodations for IEP are not available, do examiners do their best to administer? Yeah, so ideally there's some accommodations that are built into the IEP. If they're not, you do your best to kind of administer that. Um, Generally, kids with significant cognitive disabilities, there will be a decision within their IEP team about does the student get this assessment or do they not get this assessment. As much as possible, you want to screen all of your students. Having said that, for example, if I've got a kid who's nonverbal, this assessment isn't going to give me any information that I don't already know. It's not helpful in instructional planning in any way. Maybe it's something that we don't give to our students. I will always defer to the IEP team who know the students best about is this something that we should be giving to our students or not. If you can, I would say try to give it to all your students because sometimes you will be surprised. I've had several students with significant disabilities where they said, well, this student can't do anything. Let's not give it to them and say, well, let me sit down and just see what I can do. And they didn't hit the benchmark, but they had some skills that they could show. And so, again, I leave it up to when we're talking about kids with the most intensive needs and cognitive disabilities. I leave it up to IEP team to think about that. So, but that's a good question. All right. Um, and then ensure accuracy of scoring and data entry. So some of these, if you're doing a computer administered, like on an iPad, it'll score and enter it for you. But if you have to take a score and transfer it and enter it, make sure that those are being entered correctly. And so maybe it's going back to, again, a random number of probes, making sure, okay, here's the paper probe. This kid got this score. Is that the same score as what got entered? So, or maybe it's one person who's doing all the entering. You're not having teachers enter their own data. So, but you need to make sure that you've got accurate data entered. All right. So things when you're doing fidelity checks, I'm not going to read through all of these. You have these slides, but these are things that you want to think about, like when you're collecting fidelity data. Again, many of these measures have their built-in own fidelity checks, but these are some things if you doesn't have fidelity check that I would build a tool that has these kind of questions in it, like was timing accurate? Were the scoring rules followed? Was it calculated, entered correctly? These are all things that I kind of just talked about, but you want to think about how we're making sure that all of these things are happening. All right. So the last piece I'll talk about here when we talk about the before, the during and after testing is this idea. I'm going to talk about a risk verification. And so I want to use an example of why we might want to consider this. And so screening is a way, again, to identify the students who are on track and the kids who are at risk for needing some additional reading support. Though, if we don't provide additional reading support, they may not become proficient readers. And so a screener is going to look at all your students, and it's gonna benchmark, and it's gonna say something like, okay, well, these kids are identified at low risk, they're on track, continue what you're doing. And these students are at high risk or at some risk, that we need to provide some interventions for them to be proficient readers. And so what we would do then is we take all those students who are identified as high risk, they're in need of intervention. We would want to provide intervention to those students. All of our students would receive tier 1 instruction. Even the students identified in need of additional support, they still get high quality tier 1. We don't take them out of tier 1 to give interventions. We do that in addition to. And so we want our screeners to accurately identify all kids' level of risk. But even though screeners are better than that teacher referral model, they are not perfect. There is no assessment that is perfect, and it's going to be 100% accurate all the time, because there are things that you just cannot control for. A test cannot control for, even when you do it with fidelity. You cannot control for if the kid's having a good or a bad day. You cannot control for if the passage they're reading is something they really like versus they don't like. I had a kid who was not a proficient reader, really struggled quite a bit, but she loved horses. And we had a passage about horses, and she killed that passage. Like, she was just awesome at it. Versus sometimes kids are reading passages about they don't care about it, they don't know anything about it. They're a good reader, but they just have no investment in it, so they're not going to do well on it. We can't control for that, right? So they're standardized passages, all kids get them. And so we want to make sure that we're really looking at our screening data in ways to make it more accurate. And so sometimes what you're going to find is something like this, to where we have our screener on the right here, where we've identified all of these students as low risk, and they're accurately identified. All these students are at low risk. But all of these students have been identified as high risk, and we've got 2 kids that are actually not at some level of risk. They are actually proficient readers, or on track to be proficient readers, based on other assessments we have. All the other assessment data said this is not a student who is at low risk. And this is a typical pattern of screeners. They're typically built to over-identify kids instead of under-identify, because we would rather identify more kids that need intervention and then find out later, okay, these kids did need intervention, they're okay. That's a better scenario than if we're under-identifying and missing kids that need intervention. That may make us feel better as instructors that, oh, we don't have a lot of kids needing intervention. But if we're missing kids, again, they're going to go months, years without reading intervention that they actually needed, and they're not going to become proficient readers. And so what happens when we have like a reading screener that identifies some kids that actually don't need reading intervention? And so that's when this idea of risk verification comes into play. And so what is risk verification? And so it's where we want to use screening data together with a couple of other appropriate data sources to kind of triangulate the data and verify, does a student really need or not need additional support? So this may be where we've got all of our students who are identified as at risk and needing intervention, and we give them some other assessment, or we have an existing assessment that all kids are already getting that we can help triangulate data. And so example measures for early literacy include, maybe it's a diagnostic assessment like a phonics survey or phonemic awareness assessment. Maybe it's additional curriculum-based measure probes. Maybe it's a progress monitoring assessment. Maybe it's classroom assessments. But you want to have some agreed upon. We're going to use these couple other data sources to make sure that kids are actually at risk. And so what does that look like? And so if we give our screener and we find, yes, this student is at risk, but we give 2 other measures, they also say, yes, the student is at risk on these other measures, then we would want to go ahead and provide intervention to that student, because all the data says they're at risk and need some additional support. Alternatively, if we find that the student is at risk on our screener, and you have this where screening data comes back, you're like, huh, like that kid does really well in my class. I didn't expect that kid to score so low. I think they maybe have had a bad day. Well, if we look at our other data and we say these other 2 measures say they're not at risk, they're doing fine, like they're meeting benchmarks, then maybe that's not a kid who's actually at risk. Maybe it's just a bad day, it's a fluke. We would want to continue with tier 1 instruction. And so what is an example of what that looks like? And so on this first example, maybe we find our kid who is below benchmark on a reading screener. They're below cut point on a phonics survey that we give them as a result, and then we give them another curriculum-based measure a nonsense word fluency, a reading passage, whatever it is, and we find that they're below benchmark on all of them. That's a student that probably needs reading intervention. So we want to provide some level of support. Alternatively, we have a student who's below benchmark on the reading screener, but maybe they pass that phonics screener, they do great on it. They're above benchmark on the other curriculum-based measure we have. And so we decide for that student, we're going to continue with tier one and we're going to monitor. Maybe it's, once a month, we're going to give another progress monitoring probe just to make sure. But this is probably a kid who doesn't need a reading intervention. And so we want to be thoughtful about how we're using our data. Again, screening is not 100% accurate. It is more accurate than us just, looking at our students and using our judgment, but it's not 100% accurate. And so risk verification is a process for our kids that show up as at risk needing some additional support. Maybe we give some additional diagnostic assessment or other assessment to really verify, is that a student that really needs that level of support? All right. So as you think about these things, it's important, if you don't already have one, I would encourage you to start thinking about developing a data collection plan. And it could be as simple as like, who's going to collect the data? Who's going to enter the data? Who's going to ensure that the data is collected and entered with fidelity? So who's going to sit side by side and check fidelity? How often are they going to check fidelity? What checklist are they going to use to do that? Like, how are data going to be collected and entered? When is this going to happen? So is this going to happen, with a school-wide assessment team for this day? Are we going to expect teachers to meet this 2-week window? But when is this going to happen? So the more specifics that you have, you can use that from benchmark period to benchmark period and go back to this plan to say, this is how we collect data. So we're making sure that it's pretty fairly consistent. All right. So as you think about these kind of considerations for accurate data collection, as we kind of work towards the close here, I want you to think about maybe this first one. Before screening, the things I talked about: determine who will administer, provide training, testing logistics, preparing students and families. Just in the chat, name one action that you could take before screening that might help improve data collection at your site. Something that you heard that could help you, or it doesn't even have to be that could help you, but something that you considered or will need to consider to improve data collection. So in the before category. So I'll give you just a minute to do that. Yeah, prepare students and families. Yeah, I think it's important to make sure that students and families know the purpose of the assessment, what it's going to be, and what to expect. And that it's not a high stakes assessment. We want them to give their best effort. Right. So I know we only have a few minutes here, so I'm going to wrap with some kind of final thoughts as you keep putting the things in the chat there. Ensure adequate training and practice. I just think about, so for your next steps, like, what do you need to consider? Do you need to think about developing a screening data plan? So who's going to do it? When are they going to do it? How are they going to do it? Maybe you need to focus on your training that you're providing and revisit like refreshers for staff. Maybe it's, we need a risk verification process. We want to come up with some consistent data sources that we can use to verify when a student comes up flagged as at risk that they're actually at risk. Because we don't want that to be a case by case basis, because then we'll just use whatever data that says whatever we want it to say to determine that. So we want to be clear ahead of time. If a student comes up as at risk, we're going to use these two assessments to verify that risk. All right. So as you think about those things, think about those next steps. A couple resources in there for you. I shared this at the first one. I do think that the frequently asked questions and the resources that California Department of Ed has provided are quite good. They answer a lot of really good specifics for your assessments and your situation with the screener. So use that as a resource. And then we have a resource. I think this is from the Center on MTSS, but just, or maybe it's from us at NCII, but it's something on how you can ensure fidelity of assessment and data entry procedures. Yeah, I think that's our resource, but a nice resource that kind of verify or kind of reiterate some of the things I said as more of a kind of a checklisty thing for you to kind of take away. All right. So as we have a minute here, I'll kind of just pause there to see if there are any kind of last final questions for folks.
Yeah, John, it looks like we have a question in the in the Q&A about a small number of students, or if a small number of students are not tested during the window, is it still recommended to screen them when that window ends, or should we wait for the next screening period? Um, so that's one question.
Yeah, I mean, I would try and do it as quickly after the window as possible, because you do want to get that data. I would just consider that, as you're looking at that data. It may not be like 100% valid, reliable data, but it's still going to tell you something about that student. And so, especially if you identify, for example, a student is significantly below benchmark and it's after the window, that's still an issue. Like, it's more the other end that you want to that may cause you pause if you've got a student that looks like they're okay, but you did it after the window. That's because they've had more instruction than the typical student. That's a little bit harder to interpret, but I would still go ahead and collect that data right after the window if you can. You do your best. That's where it's like it takes the planning fallacy, right? Like you do your best to get all your kids. You're going to miss a few kids. It's just going to happen. It's hard, but do your best to get those as close to the window as possible, and give yourself grace. So.
Well, we just really want to thank you, John, for coming today and deepening our understanding of how to collect quality data, really getting that clean data. And I know I just really appreciated that reminder about how important it is that we are preparing our students and our families for this screening. And definitely that example of the risk verification process was fantastic. So I'm excited to be able to share that as well. And we are looking forward to seeing you all again. Looks on using data for support. We're really going to dig in on what are we going to do with all this information that we've collected on our students. And that will be on November 17th. So we will follow up with an email with some resources from today. And we just really thank everybody for taking their afternoon to spend with us. Thank you.